The South African Society of Psychiatrists is holding its Congress from today until November 23rd. The organization aims to discuss interventions that the delegate healthcare services to also lessen specialized healthcare workers at community level. The Congress is also expected to address the urgent need to integrate diverse voices to enhance mental health care in the country. For more on this, we speak to Dr Anusha Lachman, the president of the South African Society of Psychiatrists. Doctor, pleasure to have you on the program this afternoon. Now, with less than 5% of South Africa's healthcare budget directed towards mental health care, how does the South African Society of Psychiatrists then plan to address this urgent need for expanding perspectives and inclusivity when integrating diverse voices, especially in mental health care?
Thank you for having me. I think it's an ongoing issue in that there is a disproportionate availability of services for people with mental illness to access care, especially in rural areas, but also in peri-urban areas. And part of this is really the limited resources available in terms of trained healthcare professionals. We aren't able to match the burden of disease needs by qualifying more psychiatrists. But what we are able to do is perhaps task shift and upskill community healthcare workers, lay people to provide the kind of support and advocacy role that really people need to be able to identify mental illnesses early and to access care earlier. So part of this conference that we are really excited to embark on today is giving a space and platform for those unheard voices, for those advocates in the community, as well as putting a focus on patient experiences. If we have a better idea of what the need is from a patient perspective, we're better able to advocate for more inclusive services.
So you've been quoted as mentioning the focus on more severe mental health conditions affecting less than 1% of the population. How does the skewed focus then impact prevention, diagnosis, and access to treatment for mental illness? And what role does a task shifting play in addressing this issue in Southern Africa?
I think we focus a lot on the severe mental illness. So when we think of schizophrenia, psychotic illnesses, bipolar disorder, and we focus on really district level, tertiary level hospital care. So severe mental illness for people that need to be hospitalized. What we fail to acknowledge is that common mental illnesses are the ones that we miss. And so, for example, 1 in 3 South Africans will have a lifetime experience of a mental illness like depression, like anxiety, like a substance use disorder. And the problem is we aren't screening it effectively. We also aren't able to manage it quick enough to get a positive road to recovery. So part of the task shifting is enabling people to be more focused on recognizing the symptoms that present early on. And so early recognition is key. You can't screen if you don't know what to look for. So task shifting speaks to that need.
So considering that 1 in 3 South Africans suffer from mental illness and about 75% are unable to even access treatment, how does the Mental Health Congress then aim to incorporate lived experiences, patient perspectives, and even evidence-based options for mental health interventions on a community level especially?
You know, we often make a mistake and we think that people aren't able to access care. Like we say, 75% aren't able to access care because we think there aren't hospitals, there aren't care providers, there aren't nurses or psychiatrists. But part of the reason that people also don't access care is that there is a huge burden of stigma in the community. People are afraid of people who suffer with mental illnesses. They often cast them aside. They believe that it is responsible for most of the violence or the disarray in the community. And so giving a platform for patients with mental illness to share their experience, as well as family members, to be able to discuss with the community just how great the burden is, we think will alleviate the need for people to be afraid and to hide or shy away from recognizing and seeking treatment early. So it is really about the focus on what it feels like to have a mental illness so that we try and chip away at this huge burden of stigma.
Dr. Lachman, you've also highlighted the persistent stigma surrounding mental health. In what ways does the Congress then aim to address and also combat the stigma, especially to support family members caring for loved ones with mental health disorders?
Well, firstly, we want to be able to give people a voice, to not be afraid to say, I am suffering from a mental illness, or I have a family member that's suffering from a mental illness, and it's really hard for me, or that it really impacts my family. And so the less of a secret we make out of mental illnesses, the easier it becomes for us to address that stigma head on. I think for a long time, advocacy groups have been trying to spread the message that it really is a common occurrence for us to have family members, to have children, old people across the spectrum who suffer from significant impairment due to mental illnesses. And it's time we spoke about it. We don't lock them up. We don't shy away from it. We have these open conversations so that people feel free to tell us when they are struggling, so that we don't actually have to lead or deal with the long-term consequences of poorly managed mental health problems.
Can you share your insights into how the Mental Health Congress then plans to give a voice to the struggles of families and community members who often bear the burden of mental illness? And what message of hope or encouragement and even advocacy are you expected to emerge from these discussions?
Well, I think traditionally these kind of conferences are really focused on medication, on doctors, on procedures, on interventions. This time around, we are hoping that we shift that paradigm by giving spokespeople the platform at a mental health psychiatry conference. We're hoping that we can foster partnerships, that we learn how to support better, and that together we are on a path of recovery and healing that is holistic. So I'm really hoping that with a wealth of information that comes in, we have many local speakers, we have people from across the African continent as well as international collaborators, that we spread the word and that we have a more nuanced, contextually relevant idea of what the need is in South Africa.
Let's speak about those expected to give addresses at this Congress. Charlene Sunkel, a person living with schizophrenia, she's expected to be a keynote speaker there. How does her research on principles applicable to transforming mental health practices contribute to empowering frontline medical personnel and also foster collaboration within the Society for Prevention and Care?
We're really excited. She's our keynote speaker tonight, and she's also part of the program the rest of the week. And I think what she brings is really, again, that voice of a patient that lives with a severe mental illness, but also thrives. And what she's been able to do with her research and her advocacy is phenomenal in terms of getting mental illness central focus in terms of research agendas, in terms of advocacy, as well as policy makers. And so I think what it's going to be doing for us as a society is really steering the focus towards listening more to patients, letting healthcare workers be aware of the fact that it isn't just a paternalistic offering, that we have to look at what the patient experiences when they take our medication, when they receive our intervention, and how we can do better. Because for now it's learning from the patient as opposed to assuming the patient always needs to learn from us.
I must say the focus on moving from a doctor-patient to a doctor-community approach is also quite intriguing. Could you discuss the key lessons and also the strategies shared by international speakers to better support communities in early recognition support and treatment of mental illness?
Well, I think it's such an interesting concept because we're very focused on just a singular idea of a patient and a doctor, but actually a patient is part of a community. And when a patient is ill, the community suffers, the family suffers. So perhaps our treatment arms and our interventions need to be then focused on the community, on the family. So we often talk about that also in childhood mental illnesses. We don't direct interventions just at the baby, but actually the baby in the context of the family. And so I think it's a really exciting way in which we're changing the narrative to see what are the things we can do to partner, to collaborate, to advocate for opportunities that we can work hand in hand with community members so that we alleviate the burden for both the family members as well as the patients in consideration.
Dr. Anusha, thank you very much for your time. That's Dr. Anusha Lachman, President of the South African Society of Psychiatrists.